Dhaka is getting hotter more often and more intensely. Rapid urbanization and climate change have made heat exposure a serious public health concern in the city. Densely built areas, limited green and blue spaces, and high population density all contribute to extreme heat accumulation. At the same time, Dhaka relies on very limited temperature monitoring. As a result, the true intensity and variation of heat across neighborhoods is often underestimated. Importantly, not everyone in the city experiences heat in the same way. Some neighborhoods trap far more heat and some populations are more vulnerable than others. To address this question, we combined quantitative and qualitative approaches. We analyzed heat exposure using field collected temperature data collected in 2023 from 67 locations across Dhaka, together with satellite imagery. Alongside this, we conducted 10 key informant interviews and 9 focus group discussions with stakeholders working on heat, health, and the urban environment, as well as residents living in highly heat exposed areas. This allowed us to understand not only where heat is highest, but also how people experience it, cope with it, and where current systems fall short. We identified intra-urban heat islands across the city and developed small area heat vulnerability indexes, both at the ward level and at a very fine 250-meter grid level. These indexes combine socioeconomic characteristics, population density, urban form, and environmental conditions. The idea is simple. Heat vulnerability is not just about temperature, it's also about who lives there, how dense the area is, how much greenery exists, and whether people have the resources to adapt. Our findings show strong inequality in heat risk across Dhaka. 4 intra-urban heat islands have been identified. These are Shampur Postogola, Gulistan Shahbag, Farmgate, and Uttara Airport Bosundhara area. Nearly half of the city's wards fall within high heat vulnerability categories, and some face extreme risk. At a finer scale, more than 80% of the 250-meter grid areas fall into high vulnerability classes. The most vulnerable clusters are concentrated in the southern, southwestern, and central part of the city, particularly within Dhaka South City Corporation. In contrast, areas such as parks, cantonments, and higher income residential neighborhoods show much lower vulnerability due to greater vegetation cover, lower built-up intensity, and better adaptive capacity. These patterns matter because heat does not affect everyone equally. Elderly people, children, low-income households, and people with existing health conditions are affected disproportionately. Our study also highlights major gaps in temperature monitoring, heat preparedness, urban design, health data shortage, and public awareness. Without addressing these gaps, heat-related health risks in Dhaka will continue to grow, largely unnoticed. By identifying heat vulnerability at the smallest possible scale, this study provides evidence to support targeted heat action planning, better resource allocation, and more equitable urban health policies for Dhaka.